A nice looking nose overall. She made her look like she's from Whoville. This doctor's nose job surgeries are going completely viral because people are shocked at the results. Her name is Dr. Ferda Erol, and she's a surgeon practicing in Turkey. So why do her patients end up looking like this, and how can you prevent this from happening to you or your loved ones? Well, I'm a real holistic plastic surgeon, so let's get the answer to your questions and react to her videos. Nice looking nose overall. Now, I don't get it, but as you can see, her surgeon is very proud of this result. So let's take a closer look at the patient. Now, you can see in this photo of the patient prior to surgery that she's a beautiful young woman. Now, she does have a small dorsal hump deformity. That's what we call it, but in her situation, it's no deformity, it's just a little bump on the nose. Now, I think overall her nose looks great, and if she came to see me for a nose job, I'd probably shave down a little bit of that bump, and honestly, that's probably about it. So now let's take a look at this same patient immediately after surgery. Now you can see that her nasal tip is rotated superiorly or upwards. Now the angle between the nose and the upper lip is called the nasolabial angle. And in a woman, it's believed that the ideal angle is between 95 to 105 degrees. Now this patient's angle postoperatively is a lot more than that. In fact, I measured it at 123 degrees. And that is why her nose looks like it's so tipped up. Oh God, I think here's another one. Well, maybe she isn't so extreme with her male patients. Okay, so this one's not that bad. I think overall it looks pretty good afterwards. So let's take a look at another guy. Nice looking young guy. Little bump on his nose. Oh, come on. The ideal male nasolabial angle is about 90 degrees. And in this guy, right after surgery, he's at about 120 degrees. So why is this happening? Well, some nose job surgeons have a signature nose job, meaning that their noses look kind of the same afterwards. Now, I trained under Dr. Richard Ellenbogen, and he was a very well-known Beverly Hills plastic surgeon who did a lot of nose jobs. And the thing is that he and a lot of plastic surgeons do essentially the same thing on most of the nose jobs that they perform. So this can create a similar result if you're doing kind of the same operation. And honestly, to this day, I can spot, for the most part, a Dr. Richard Ellenbogen nose. And apparently this is Dr. Erol's signature nose job, right here and right here. Now that being said, if Dr. Erol's patients are happy with the results that she's given them, then that's the most important thing. Now I assume that they've taken a look at her before and after photos prior to signing up to surgery with her, and so they are aware that these are the after results that they'll get. Now I'm not here to critique her actual surgical prowess, it's just not my style of result in general.
I don't get it.
Now let's take a look at it before and after from the front view. Now this is actually very misleading because in that first view where her nose looks super wide, it looks like it's probably been infused with a ton of local anesthetic. Now this can really plump the nose up prior to surgery, and typically if you put a lot of pressure on it at the beginning of the operation, you can kind of push most of that fluid out. So this patient does not appear to have had a really massively wide nose to begin with, although she has made it look like that's the case. Now let's take a look at her remove a splint from one of her patient's noses. Oh my gosh, that's so satisfying. It so is.
Brother,
Now, if it looks like she's pulling the patient's brains out of her nose, the patient feels like that too.
my brain! brain hurts!
Now, splints like this are placed inside the nose as a way to stabilize the nose as it heals, especially if you break the nose in during the operation or you do some work on the septum. And typically these splints are left in place for about a week, after which they are removed. And this is one big reason why having a nose job can be quite uncomfortable after surgery. If splints are not used at the time of surgery, then oftentimes nose jobs aren't really all that painful or uncomfortable at all. So do you have to worry that your nose is going to look like this if you undergo a nose job? Well, I did nose jobs for 10 years and I gave it up about 10 years ago. Honestly, I didn't like to perform the operation. I found it quite tedious, and sometimes there were factors that were beyond my control, like deposition of scar tissue, that could really impact a patient's final result. But honestly, my patients were almost universally happy because the way I did nose jobs back then was to make small tweaks to create the changes that the patients wanted, yet still leaving them with the essence of what their nose was to begin with. And here you see one of my before and after results. As you can see, I removed the bump off of her nose, but her nose looks similar to how it started. And overall, I think it looks very natural. So this is why if you're considering a nose job or really any plastic surgery, you have to be very careful with the surgeon that you choose. Look at their before and after photos and videos and make sure that the results match what you are looking for yourself. It's always best to try to get it right the first time in plastic surgery. So what other extreme plastic surgeries are going on in the country of Turkey? Well, some of the facelifts coming from Turkish plastic surgeons need to be seen in order to be believed. Are they real or sus? Take a peek at this video right up here where I show you some before and afters that will absolutely blow your mind. Are they real though, or are they sus? And remember, eat real food, use clean skincare, and auto-rejuvenate before you operate.